जी सर, अल्हम्दुलिल्लाह ठीक ठाक।
अल्हम्दुलिल्लाह सर।
Zabardast, zabardast. So we'll wait for 5 minutes. How many? 25
अ,
participants. Let's see how many comes in.
25 पार्टिसिपेंट हो चुके
जी
हैं
सर,
अभी।
बस सर काफी। सर स्टार्ट करते हैं।
स्टार्ट कर दूं? अच्छा चले, क्योंकि इसमें 40 मिनट्स हैं तो वो बीच में फिर
जी जी
डिस्ट्रप्शन हो
सर
जाती है,
स्टार्ट
तो
करें।
I'll try to finish within this 40 minutes and then we'll go for discussion, inshallah. Okay, so I
सर
start. uh, Right. Okay, right. Okay, जी, Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. This is the continuation of yesterday's presentation or a lecture. Yesterday, we did talk about governance in healthcare settings or health administration. Today, what I'm going to do is I'm going to talk about ethics and accountability in healthcare settings. Basically, all these three subjects go in hand in hand. Like, for example, yesterday, what we did talk about, there would be some repetition today as well, but we have put a different words to it. But anyway, that is just because, it is a chain of things that there is governance that is tied with ethics and tied with accountability. And in the end of the day, what we are looking for is a better quality of healthcare services to our people. So I hope that yesterday's lecture was clear and you had a good understanding of the means not the real understanding, because for real understanding you have to go for a full course, but just to as with your experience in the hospital administration or health administration, it's just a kind of a brushing up your knowledge, or kind of refreshing your knowledge. Mashallah, you all are wise, you are all knowledgeable, you can do things. I did like the conversation or discussion yesterday. It was very open, candid, and to the point. I would like to do that today, inshallah, as well. I'll try to finish my presentation in this session, and then I would like that we have more discussion, because uh, unfortunately or fortunately, these online things are a blessing as well as they have their some impediments. Like you all are some, maybe some of you are sitting at home or in the office. I'm sitting at home delivering this lecture. But I'm a kind of a person who is from the old thought. So I believe in more class to class or face to face teaching, where you interact, you see faces of your students, how they react. Here I cannot see whether you did understand or not, because I've been also doing a lot of meetings and courses on online, and sometimes you just put it off, go for a coffee, do something. But anyway, what we need to do is we need to get best out of it, and I'm thankful that IPH has started this. At least if you are not making it 100%, at least you're getting 80%. Something is coming, and something is always better than nothing. So we appreciate that. This is my old institution, and this is the prime institution in public health, and you are all lucky to be part of it. And definitely one day you will see that this institution, what you were taught here, will be useful in your practical life. Just note that. Even one liner today, if you, not only from me, the other vice lecturers, or even the lecturers at the IPH, they're all very educated and experienced. So try to get something out of that, that, that will help you in your life. I know there are a lot of problems around. In theory, we talk, today we'll be talking theory, right? But we were discussing practicalities also. But theory makes the practical easier. So it is always you have something in your mind theoretically, and then you go and do it practically. So now I will start, because otherwise I'll just keep talking on other things. So today we are going to talk about ethics and accountabilities in healthcare settings. Uh, Now, if you see, there are always very elemental or fundamental principles of different things we talk about. For example, here, if you see the core fundamentals of core ethical, principles that we are going to talk about, it has four pillars basically. We have divided them looking into the international scenario. The first one, if you see, is autonomy. So, autonomy is not that you are independent, right? Autonomy is a basic right of humans. The way I see that is like you want to be independent. Countries need to be independent. You want to take independent decisions. We just put you in one room for 5 days and tell you don't go out of it. For example, you can take an example of COVID, that you were strained in your houses, rooms, or whatever, but you wanted to go out. And if nobody stops you, you can stay in that room for 5 days, do nothing, and you don't need to go out. But once I tell you, or somebody tells you, please don't go out of this room, you will say, oh my God, I had 20 things to do, and this guy is stopping me. So that's why I brought this autonomy, is that it is you're respecting the right of the patient. That is very important. So we need to have his, what you call it, his consent, his privacy, his freedom, that it comes from him. That it's not that the doctors or the healthcare providers put some pressure on the patient to do this and to do this and do this. Yes, definitely. In a clinical setting, sometimes you have to put some pressure for his or her betterment. But we need to respect the independence or autonomy of a patient. Secondly, beneficence is like, you always act in the interest of the patient and the community in the end of the day. What are you trying to do is? So, what we need to do is we need to provide excellent services to the community, to the people, those who come to your health centers, that they get the best out of it. The third one, if you see, is non-maleficence. Non-maleficence, these are a little bit of jargons, but these are very plainly explained here, that we would not like to harm anybody, right? We would not like to harm the patient. We would not like to harm the institution. We would try to minimize and prevent all medical errors, right? And also, we will look into the vulnerable population and neglect the abuse. So these are all things, if you see, I have jotted down here, are the crux of non-maleficence, right? So non-maleficence is basically that you do your best practice. You are sincere to your patient, you're sincere to your institution, and you are going to do your best for their best outcome. The fourth one is justice. We did talk about that yesterday, why we need justice. We did talk about justice is that you need to fairly distribute the resources among all your patients and give equity, whether is it a poor person, a disabled person, an elderly person, a person of different religion, different caste. Means it could be any. There are thousands of examples we can put them. So that is our role. So that is our role as a man in justice with the health ethics. So now, if you look at these four pillars, keep these four pillars in your mindset, and then we will develop on it. Because this is theoretically, we are trying to do all that, but practically may not be possible in some instances. But try to keep this in your mind while you're at work, and then inshallah, it will help. Next is, yeah. Now, taking an ethical decision making in a healthcare management, it is stepwise. You have to go through first step, second step, third, fourth, fifth, and looking into these things, that what do they mean actually. So if you see, identify the ethical issue. What we need to do is we need to identify whether is it a medical issue, is it a treatment issue, is it an ethical issue, what kind of issue it is. As an administrator, you need to see that whether it is the treatment problem or the clinical problem, or if it is the some other problem with the administration, or medicines are not provided, healthcare is not provided. Identify the issue at the first place. That is really very important. Secondly, is gather relevant information. You must, before taking the decision, you must gather relevant information. That's why we say informed decision. This will lead to informed decision. Gather relevant information from the patient, from the workers, from the doctors. Look at the what are the SOPs of the hospital or that particular department, what are the policies, get all that and then see where it is going. Thirdly, consider all the stakeholders. Now, who are the stakeholders? Stakeholders is the community, it could be clinical staff, administrative staff, patient, relatives, community. These are all the stakeholders. So, in totality, if you look into the stake. Can we mute that, please? Okay. Then from here, we go to ethical frameworks. So, as I have already mentioned, so those four frameworks, I think they were like autonomy, beneficence, and non-maleficence, justice, and then we need to focus on the character, the integrity of the patient, and integrity of the health staff. So, all those things that the four pillars we did talk about, and then adding to it will lead to our ethical frameworks. Fifth one is choose and implement action. So, if choosing and implementing actions basically is like it should be very clear. It should be in the favor of the institution and the patient. In the end of the day, it should be transparent. People should understand it clearly. And in the end of the decision, everybody should be happy. Though it is not the case all the time, but sometimes you have to take hard decisions. And then you will implement that action. And lastly, the sixth one is in evaluating or reflecting your decision that whether what decision you took, was it successful? What are the lessons learned from there? So next time you are more careful, you are more clear on the things that next time this kind of thing happens, you can take a better decision. But if you see this whole circle of six, each each point has its own importance. I mean, the identification, relevant gathering information, looking at the stakeholders around them, the frameworks of the theory, then you choose with your experience and your you talk to your co-workers, your maybe your superiors, your juniors, then you ask them to implement that, and once you go for implementation, evaluate it. Evaluation is important whether you took the right decision or wrong. Maybe that time, because we are all humans, we may not be the best taking a decision people, right? So you always need to evaluate and then reflect in your next coming things. So next time you will be more educated, more careful in taking decisions. Moving from there, now what we do is in ethics and in accountability, there is a very important part which is called confidentiality, privacy, and informed consent. These are the three very important issues that you come across every day in your life. So we would start from patient confidentiality. What is patient confidentiality? You all know that it is the protection of the medical records under the our Punjab Health Code. Staff is legally bounded to provide the professional duty. Uh, And then the digital records are not to be given to others which are you know, persons who are not related to. So those records stay with the health people, and then even the if patient requires that, we can get that. Secondly, is the privacy rights, and that is patient should be told what problem he has. This is really very important. It's a very sensitive issue, and if you see, I've just put on HIV, which is social taboo in our society, even in the West also, and the mental health. If you tell somebody you have a problem with the mental health, somebody going to the psychiatrist or psychologist, in our culture, you know, the pagal ho gaya ji, the dimag kharab ho gaya, pagal khane bhejo. So these kind of things, they come in, right? So you have to be very careful in making these kind of decisions and engaging the patients. Like if you look around the world, like in our country, we are like in the mid of things that we would tell, but in a very soft tone, in a very clear tone. Like in the US, what I've experienced there, the doctors would say just directly to the patient, you have one, and these are your chances, and this is this, and this. So they're so blunt, which as a human is not what I don't agree to that. But because in their healthcare system, what they have is litigation. Maybe the patient can go to the court and say, this doctor did not tell me anything about my disease in the first place. So he need to be sued for that. Then comes the second example of England. In England, they are more of our side, like, you know, because they would be very gentle. They would tell, okay, we have a problem here. We are trying to help you out, and this and that. And yes, things could be more serious, and we need your cooperation and things like that. So we need to take the patient and their relatives in confidence, keeping the privacy rights, that you just don't take the banner out and say Mr. So and so has HIV, Mr. So and so is taking medical or is taking mental health advices, right? Lastly, it is a very common practice, especially in surgery, is the informed consent, and even in procedures in medicine also. You must give or you must take a consent from the patient and their relatives. And if you see, it is basically a very informative and uh, a thing that for the patient and for the patient delivery person, that this has to be taken. We need to explain the person that what are the problems, and you do that all the time. You can talk to them in Punjabi, Pashto, Urdu, whatever language they speak, and you explain them very clearly that this is the problem. But there could be some special circumstances that are put in the last line. This patient who are minor, those who cannot speak, patient with serious injuries who are unconscious, and people coming to the emergency, then there is no time to do that kind of thing. But you do that quickly. On the right corner, if you see, I put a legal anchor, which is the Pakistan's 2002 hospital, PHIA, what we call it, is the hospital regulations. And in violation of that, it comes under BBC Section 377A. I am not a legal person, but while I was preparing this slide, I thought that this may be useful in those who are in the forensic medicine, or you're doing, autopsies or medical legal cases. They must be much more aware of that. But this is just for your information. And what they say is the common breaches in Punjab hospitals. This is sometimes I put these kind of notes so that can be used in our discussion. They say that the paper record is not safe. It is unsecure. People can have access to that. People have they talk about these kind of records in the public, and you get a consent written on an English paper, but you don't translate that in Urdu or Punjabi. You don't tell them. And then they say no proxy process for unconscious patient, that they should not be a proxy to that. If he or she is really unconscious, we don't need a proxy. We need to do the best we can do. Next is in the organizational ethics. Now, one of the personal ethics, now the organizational ethics, which we will be talking about whistleblowing, conflicts of interest, and professional boundaries. These are the three subjects we will be talking about. The first one here is whistleblowing. What is whistleblowing? It is that somebody announces that, okay, you blow the whistle to engage people from all around. So a thought on a duty, he can be a whistleblower that something has happened. There could be some kind of incident with that worker. Somebody was trying to harass that person. So it is your duty to report unethical conduct of your colleague, of your patients, of the patient's family, or the relatives, and it is required under the whistleblower protection. And these kind of channels are operational in every means I just put a DHQ, but it's not only the DHQ, it's all the hospitals of Punjab. Secondly, a conflict of interest. Always it is important that we must keep conflict of interest in our mind. That if you are going to buy or you procure something, you don't procure it from your relative, from your friend, or your own company. Your supplier is your relationship. In relationship, he is your brother, sister, or whatsoever. So whatever you do is it should that kind of thing should go through a proper scrutiny, and there should be no conflict of interest, and it should be mandatory to disclose that under the protocols there is no conflict of interest. For example, sometimes we do research and we write papers in your MPH and your PhDs and your diplomas, and we write that there is no conflict of interest in writing or doing this research and when you are publishing this paper. So conflict of interest need to be kept in mind. The third one is a professional boundaries. Every At the global level, there are ways and means that we keep these professional boundaries. And then comes the social and the cultural aspects, right? So here, what we see is that the administrative and clinician people, they always should remain professionals. They have their dual roles. Sometimes the clinicians are administrators and administrators are clinicians as well. So there should be a very clear demarcation of professional boundaries. That what medical superintendent is doing, that is his part of work, is administration. And the professor of medicine has nothing to do with that. And the vice versa, the medical superintendent is an administrator of the hospital, and he has nothing to do with the medical superintendent, with the professor of medicine, or professor of surgery, or ophthalmology, and so on. So that's why we should have this clear demarcation, and there should be no influences on the treatment plan, on the way we deal with the patients. So this is just a point that I wanted to bring all these three ones, that these are internationally used all around in ethics of the healthcare facilities. Okay, now we have accountability mechanisms in which we have internal controls, external oversight, and community feedback. We did talk about this yesterday. I will try to quickly pass through it. And the internal controls, we did talk about that there would be an internal audit. We will have proper laid out standard operating procedures for all the clinical departments and the administrative departments, and they need to follow those. And the procurement committees, they have all their members, all their meetings should be minuted, they should be documented. God forbid if something goes wrong, they have the minutes and those documents to save them if there, God forbid, there is a problem. So that's why having a documentation in a proper way always helps. And fourthly, we need to review the staff performance and looking at their ethical issues, whether they had few or not, and if they had more, uh, they should be even rotated to another place. They should be given a short leave. They should go through kind of uh, under the, not surveillance, but they should be given, if treatment is required, they should be given treatment. They should have counseling or things like that should be provided. So these are actually internal controls. And as I mentioned yesterday, internal controls that is not like that you throw some person out or you say, okay, you get lost and you are not able to do this, you are not fit for the job. Give chances. Maybe he or she has problems. You don't know them. That's why you need to dig in and get information from that person why you are behaving like that. And maybe he comes up with something which you may be able to help. Maybe he or she needs a little bit of counseling because of family matters. So that's why it is the work is being affected, right? Maybe he has some kind of a problem, maybe a problem with any of the organic systems in our own body. He's suffering from high blood pressure and he's not taking medicine. He's diabetic. He has other problems. So you need to understand what kind of problems you're facing with, and accordingly, then you need to put the controls over that. Second one is the external oversight. We did talk about Punjab Healthcare Commission, Auditor General, and Parliamentary Health Committee. I put NAB all the time. I don't know. They keep on telling that this is what it is. The investigation for the now I think they have changed some rules that which if the corruption was at a very high level, they will come in. But you must have heard this Auditor General or the audit paras are very common in your life. I understand. Punjab Healthcare Commission every I don't know, not every month or every 2 months or every 6 months, but you really see them now most of the time in the hospitals, um, and they're doing a good job. I understand. When I was here practicing, at that time there was no Punjab Healthcare Commission. So now I think it's a good watchdog and oversight at the external level. And lastly, if you see the Parliamentary Health Committee, yes, people are asked to go there and give their performance. Maybe the minister, the secretaries, or even the head of the boards of the hospitals can go there. Thirdly, always we always miss one part, and that is the community feedback. Why I say it is important. In the end of the day, what are we trying to do? We're trying to give best treatment services to the people. We are the people. So we have to, that's why we are sitting in the hospitals, in the health department, to prevent, to protect, and to treat and to control diseases. So patient satisfaction is utmost. You can have small surveys from the uh, patients. Those came to your hospital. Was it satisfactory? Was it non-satisfactory? Was it good? Was it excellent? Very good, or whatever? You can talk to the community health councils. Then you have, if you have grievances, Citizen Grievances Act will come in. There are helplines, and then you can always bring them in their reviews of your work, of standard operating procedure, the budgets, and making a rules and regulation. Maybe some kind of rule which is fine with you. It's an old rule made by the health department, but now the communities have changed and they think that this can be amended with the consultation of the community and with your oversight of the health department. That can be a middle way could be found out, and those things can be amended according to the new rules and regulations. One, and with the participatory approach of the community. Right. A lot of talking today, looks like. I hope you're not getting bored. But anyway, I'll be just finish. We have 9 minutes. Okay. Transparency tools and anti-corruption practices. Here we have transparency tools. I've already talked about citizen charters, open data portals, grievances redressal, performance scorecards. We did talk about that yesterday, but I just brought this that you can just go through it quickly. And then anti-corruption measures, if you see the Prevention of Corruption Act of Punjab, Employees Efficiency Act of 2010, procurement ethics, PEPRA rules, asset declaration for the seventh grade and plus, and then you need to take that to the Chief Minister Inspection Team. And then lastly is the zero tolerance of the Health Department, and we must also abide by the rules and regulation of the Punjab Healthcare Commission. The drug inspectors come in, and if we are doing something wrong practices, we are liable to that, and that's why we have to take care of that. Okay, let me see. Okay, now quickly I have to. These are the ethical leadership and decision making and governance. Here, if you see the traits of an ethical health leader, I think I will just concentrate on this one more than the other ones. The reason is how you become a leader rather than an administrator or a manager. Leader is to have a leadership qualities as starts with your integrity. Believe you me, if you are clear-headed, you are honest with your job, with your work, that is the first ingredient of the leadership, right? And if you see, it says consistent alignment between stated values and actual decisions. That's the integrity. I've already explained that. The second part, whatever you do is transparency, open to failures, successes, limitations. Third, accountability. You are accountable. If you do something wrong, you will be accountable. If you don't follow rules, you will be accountable. The courage, that's a big one. Willing to change. Willing to change is something important that some people don't want to change. They say whatever is going is fine. That's okay. I still remember when I joined Institute of Public Health. At that time, we were having this DPH. It was Diploma in Public Health. Uh, I still remember I went to my first class. At that time, I came from the US doing my MPH, and I was a young guy at that time. I walked into the class, and 95% of my all students were white or gray-headed. And at that time, because the promotion was linked with DPH, and most of those AMSs or DMSs were there, and they all stood up, and I felt like that. Why are they are senior to me, and why they are standing? So I said, no, please have a seat. You are senior to me. Well, I'm here to teach because I got this knowledge, and I want this knowledge to be imparted to you. Uh, so what happened then? I just started my lecture, and in the end of the lecture, I said, well, okay, I'll stop here. Are there any questions, comments for this? And believe you me, एक डॉक्टर साहब बोलते हैं उनके जी कि क्या क्वेश्चन हम पूछ सकते हैं? And I was like taken aback. Oh my God, what do you mean you can't ask a question? He said, I will not name anybody, but जैसे कि जी यहाँ पर सवाल पूछने पे सप्ली लग जाती है. And it was something like, oh my God, what is happening, right? I said, no, this would change, right? I think I was young at that time, and I thought that no, the change should come. So I said, no, you ask questions in my class. And then we started people, and the people started asking questions. And I don't know about the other classes, but for my class, it was there. And then that was the time that we started going for MPH and so on. So it's not my courage because my dean was there, my seniors were there, they were helping me out, and we did some good changes at the institute. Before that, they were just some kind of the administrative guys at the clerk level. They were playing with things, but then when we came in, we tried to change things. And now, mashallah, I see IPH is going very well under the leadership of Dr. Saira and their team, and inshallah, they will do much, much, much better. Going next to that is if we stop, we will reconnect because last two slides I will complete in the next session. For example, if I don't finish in this one. and then we will start our discussion. Uh, empathy. Empathy is really, you should be empathic. Empathy is really, as a doctor, they say you are the person who give help. Help Allah gives, but you are the instrument for that. So we need to give empathy. We need to, because we are the first liner working with the patients. They're coming in a bad shape. They need to be treated, and we give them the best thing. So be empathic towards the patients, to their relatives, as much as you can. And then the leadership is a servant leadership is that puts the welfare of patient, staff, and community above personal gain and career. It's a difficult one, but this really makes you a leader. That you forget about your personal gains and do it for the people, do it for your patient, do it for your juniors, do it for others. That kind of things can be done, and then you become a leader out of that rather than an administrator or a manager. On the right corner, if you see, I've put something like leadership challenges in Punjab Health Department or Punjab Health System. We all know, but I've just re-emphasizing it: the political interference in the appointments of the doctors, nurses, and the paramedical, and all the staff transfers as a punishment for nothing. Uh, is not the right thing to do. Inadequate management training for clinicians. This is really important. The clinicians need to understand a few things of public health, and the administrators, not to go for clinical part, but the administrators, they should be more trained in their own part. And the last one is low staff morale and brain drain. We have already talked about it. Still, we have 1.5 minutes. Reform could be a merit-based appointments, mandatory ethics training. I am good for it. CMEs are very important. Peer accountability, networks. People talk about it. This guy is not doing fine. We can help him or her. Transparent performance reviews. You do a very transparent review, and that will help you to be on the safer side, and stronger whistleblower protection, that if something happens to one of your colleagues, he's a whistleblower, she's a whistleblower, and then it can protect you the next time. So it will, I think in a minute it will stop. But anyway, we will go to the next slide from here. The morale and the brain drain, will take on that also, that how we can, but I think rather we will discuss that in our next session.
अस्सलाम वालेकुम सर।
जी भाई सलाम।
सर 1 मिनट के बाद ये सेशन ख़त्म हो जाएगा, फिर न्यू लिंक, यही लिंक को ज्वाइन किया जाएगा।
मैं वही कर रहा हूँ, मैं वही करने लगा,
थैंक यू
बस
सर।
अभी ये बंद हो ले तो फिर मैं कर देता
जी
हूँ।
सर।
Yeah, I'm just waiting. I think it's going to finish now.